You got the results back. You went in feeling perfectly fine. You had no symptoms, no pain, nothing worrying you. And now you're sitting with a piece of paper that says follow-up recommended. And suddenly you can't think about anything else. That shift can happen in an afternoon. And sometimes, honestly, it doesn't need to happen at all. I've been thinking about this. I know it's not a comfortable thing to say out loud, but after watching what happens to people who went in for a routine checkup and came out on a medical treadmill they never expected, I think it's worth talking about honestly, because the message we've heard for years is get checked. Catch it early, stay on top of everything, and there's real truth in that. But there's a part of the story that doesn't get told: what happens after you find something. Even something that was never going to hurt you. This is the channel where we talk about that. There's a concept in medicine called the cascade effect. You start to see it everywhere. Here's how it works. You feel fine, you go in for a screening, the test finds something, maybe a small spot, maybe a number slightly off, maybe a shadow. It might have been there for years and would sit there 20 more without ever bothering you, but now it's been found. And once something is found, the system has to respond to it, so they refer you to a specialist. The specialist orders a more detailed scan. That scan is still not clear. So now they're talking about a biopsy. Each step carries its own risks: infection, bleeding, anxiety. And 9 times out of 10, you find out it was nothing. It was never going to hurt you. But you've been through months of worry. You've had procedures, maybe complications, and you're worse off than when you started, all because of a test you got when you felt well. That's the cascade. It starts with a single test. The first one sounds incredibly appealing. Whole body scans, full body MRIs that promise to check everything at once. You've seen the ads. Come in, we'll scan you from head to toe, catch anything before it becomes a problem. And I understand the appeal, truly. The idea of having complete knowledge, of being in control. That's not a crazy thing to want, but here's the reality. Say you're 65, you feel great. You decide to get one of these scans just to be safe. You lie down for 30 minutes. A few days later, you get your results. And right there in the report, the radiologist mentions something. A small nodule in your lung, 3 millimeters, the size of a pencil eraser, or maybe a cyst. A spot on your liver. The report recommends follow-up imaging in 3 to 6 months. How do you feel in that moment? You went in healthy and came out with something to watch. Every time you take a deep breath, you wonder about that nodule. Every time you feel anything. Here's what the research shows. When they scan healthy people over 60, they find something unusual. We're talking 90 to 95%. The medical term is incidental findings discovered by accident. The vast majority of them will never cause a problem. They're like wrinkles on the inside. Normal features of a body that's been alive for decades, but once we find them, we can't unsee them. And that's when the cascade begins. Studies have followed people who got these whole body scans. The people who got scanned didn't live any longer. They didn't avoid more diseases. But they did have higher rates of anxiety, depression, and unnecessary procedures. The scans didn't make them healthier. In many cases, they made them sicker. What should you do? Focus on how your body actually functions. Can you walk up 2 flights of stairs easily? Can you get up from a chair easily? How's your balance? How's your sleep? These things tell us far more about your health than a picture of your insides. If you want a real checkup, sit down with someone who will go through your medications with you. Talk about your diet, sleep, and social connections. Those everyday things actually shape you. The second test touches on a fear that's real for us: getting a brain MRI for minor memory issues. Maybe you're in your mid-70s and you've noticed it takes longer to pull up a name. You walk into a room and have to stop and think. Normal things that happen to everyone. But your kids are worried, they've heard about Alzheimer's, they push you to get a scan. Here's what you need to understand. A brain MRI for occasional forgetfulness is almost never helpful. You get the scan. A few days later, you're reading the report about mild cerebral atrophy, age-related white matter changes, small vessel disease. These words sound alarming. But here's the truth. Those findings are completely normal for someone in their 70s. They're describing what every brain looks like at that age. It's like scanning skin for wrinkles. I've seen women sharp as anything, managing finances, reading, and their MRI looks terrible on paper. The image doesn't always match reality. 90% of adults over 75 have abnormal findings. What's a better approach? Simple in-office memory tests. Remember 3 words: draw a clock. These measure how your brain is actually functioning, not just what it looks like. And if those tests show a concern, then you look for causes. Most problems are reversible. Medication side effects, low vitamin B12, depression, sleep apnea, thyroid issues. Fixing one brings it back. We're treating the person, not the image. The third test surprises people. Stress tests. Specifically, putting someone on a treadmill simply because of their age. Here's a common situation. You're 72, you feel fine, you can walk miles without chest pain, you're going for surgery. If you can walk miles in your daily life, what is the treadmill going to tell us? But protocol is protocol. Here's the problem. Stress tests have high false positive rates in older adults. The test says something's wrong when nothing is. It could be medications or other reasons. But once the test comes back abnormal, the conveyor belt starts, a cardiac catheterization gets scheduled. That's where they thread a tube through an artery. It's invasive, it carries risks, and often it's nothing. Often they find exactly what you'd expect in a 72-year-old heart, some plaque, some narrowing. Now you've been labeled a heart patient. Maybe you were playing tennis before, but now you're afraid. If you want to understand your heart risk, there's a much better tool, a coronary calcium score. A quick CT scan, 5 minutes, no treadmill. It measures calcified plaque and gives you a number. The calcium score gives you information so you can make choices. It doesn't send you down a road. The fourth test is nuanced. Colonoscopies, specifically routine screening after age 75. Let me be direct. Colonoscopies are valuable. I'd encourage anyone in their 50s or 60s to stay current. But every medical procedure is a balance between benefit and risk. That balance shifts as we get older. Colon cancer takes years to become dangerous. If you're 80, is that benefit worth the risks? There's the preparation, the liquid that keeps you up all night, which can leave you genuinely weakened. And then there's perforation. The risk of a perforation roughly doubles or triples after age 75. For an 80-year-old, emergency surgery can mean the end of independent living. The math changes. That's why guidelines recommend stopping routine screening somewhere between 75 and 85. What do you do instead? Pay attention to symptoms, changes in bowel habits, blood in the stool. And you eat fiber, more lentils, more broccoli, more oatmeal. Prevention with zero risk of perforation. So here's what we've covered, not as a list, but as one connected idea. The pattern is the same. The cascade. One finding leads to another, and the question of whether you're better off gets lost. Health isn't about perfect test results. It's about function, being able to do the things that matter to you. Walking, reading, laughing with people you love, staying independent. Protect that first. I want to hear from you. Have you ever gone through a medical cascade? Leave a comment below. Share this with someone you care about. Take good care of yourself. And remember, ask a question first.